everyone. Welcome to another episode of Wellness Day, a podcast coming to you every Wednesday. Here today, we're going to be talking about everything homeopathy with Dr. Tehrat Wadia Vinzanekar.
Hello.
Thank you for being here today. First question, we're talking about homeopathy. Obviously, it's a topic that people have varying opinions about. How do you address that upfront with people who come with you with skepticism?
Homeopathy is a very old science. Originated years back in Germany, has been practiced extensively in India with excellent results. I come from a family of homeopaths. From my granduncle, my kaka, my aunt, all homeopaths. So I've been brought up on homeopathy. That's a system of medicine I have taken all my life, learned it. So I practice it with a lot of passion and a lot of faith because I believe in it.
Okay. And where have you found it to be most beneficial in your experience? Where can you talk about examples that you found it to be really helpful for?
So a lot of people see homeopathy works in many fields.
Right.
We can be the general practitioner who practices homeopathy and dispenses medicine. I find it most beneficial in children.
Okay.
Small children.
So it's actually a myth that children shouldn't be taking it or things like that.
Yes, it is. It works fabulously on children.
Okay.
Children coming with very fragile immune systems when they're born, experiencing everything for the first time, the first summer, the first winter, school infections, nursery infections, and homeopathy works on them excellently, very gently, and takes care of the problem.
They must be preferring it also because it's nice and sweet.
Yeah. And kids are my big fans. I mean, yeah.
It's like you're giving them candy.
Yeah, candy.
But what are the kind of things that you treat, that you find most common that you end up treating?
So it can work
children,
with even acute remedies, acute illnesses such as you have the flu or you're recovering from a viral infection. To treat a viral infection, cold cough, stomach upset, diarrhea. It can even be for more chronic ailments such as bronchitis, asthma, long-term treatment.
So it's actually okay. So that's another myth that people think that homeopathy takes a long time to start taking effect.
No, it can work almost immediately if you have an injury.
Oh, really?
Say you give a remedy like arnica.
Okay.
We see kids feel better so instantly. Cold cough, stomach upset, urinary tract infections in children. It's so mild, it works so efficaciously.
Okay.
Sometimes, yes, they have chronic asthma. So we all know, like if you're going to take the pump, you're going to take it for a couple of years or the rest of your life.
Absolutely, yeah.
So homeopaths don't say don't take it. Take it. Let's also simultaneously treat your allergies with homeopathy.
Which actually was going to come to my next question. How do you deal with having medicine or allopathic medicine and homeopathy at the same time?
So both can work side by side, hand in hand. So sometimes you have a flare-up of a situation. So I tell my patient, please go, take some necessary medicine to bring this into control immediately at a quicker, rapid rate. Like a child has fever, I'll say, please take a paracetamol. But for the infection, I would definitely treat with homeopathy. It can go side by side. In fact, in some chronic cases where they are on long-term allopathy, homeopathy works, improve the immune system and reduce the amount of allopathy that the child or the adult actually lands up needing.
Okay. And what about pregnant people?
Very safe for infants, very safe for pregnant mothers, lactating mothers. For older people with multiple issues, sometimes they require chronic medicines, but homeopathy works very effectively and safely for them also. So I can safely prescribe it from a one-day infant to an old geriatric patient.
Okay. And how do you prescribe to particular patients? Because the experience that I've had coming with homeopathy, with homeopaths, and it's even with you, when I've come to you, what I've always found is that they always, and you particularly, it always take time to understand the psychology of the patient and where they're coming from the state of mind, and from their mental side and emotional side, more than just the what they're coming to you with, and then you make your assessment based on that, and then give the particular kind of medicine accordingly. So I just wanted to understand your thought process on how you do that.
So see, we're here right now at the wellness center.
Right.
The word wellness means body and mind health, state of well-being. It's not a slice of a cake.
Absolutely.
Okay, so the body has to be treated as a whole.
One doesn't work without the other.
Yeah. So in homeopathy, you specify a little more in understanding the patient. It's not a one remedy pain for everybody.
Right.
Okay, what is the origin of pain? Sometimes it's not always valid with acute things, like you ate something, you had a bad stomach. That's a different situation.
Yeah.
But if you have chronic irritable bowel syndrome, which is going on for a couple of years. Why is it triggered? What are your triggers? So detailed case taking, a remedy specific to you and your personality type.
Right.
Two people suffering from IBS may be of complete different stark personalities. So, understanding that and giving a medicine specific to you is important. And it works better.
And it's so different. I mean, now people are starting to get into personalized medicine and allopathy and things like that. But what you're saying is that this has always existed in homeopathy.
It's always existed. Understanding the person, customize a similar remedy working very beneficial on a person who's angered, temperament, irritable, somebody who's anxious and nervous, and hence that is triggering the problems. Understanding that and giving a remedy specific for that, the results are always the best.
So what you're saying is that you're nearly as much a psychologist as much as a...
It helps, yes. And we do have an entire semester on psychology when doing BHMS.
Oh, really?
Yeah.
So you're saying most homeopaths are psychologists as well?
Not psychologists, of course,
have some kind of training
but the
in
mental
that
sphere is very important. Understanding the patient before prescribing the remedy.
Okay.
Yes.
Right. So what are the other biggest myths that you feel that need to get addressed when people come to you?
A couple of myths. Now, see, homeopathy has been here for a lot of years and shown many, many beneficial effects.
Right.
But it's still questioned.
Exactly.
Is it really just a placebo? I don't believe so. I can't have an infant who's coming to me and I'm giving remedies and they're getting better, responding to a placebo effect.
Yeah.
For example, in Diwali right now, I'm treating pets. I'm giving homeopathy to calm their personality, the irritability.
The dogs, cats?
Yes.
Really?
Because how they respond when there are crackers. The dog is not understanding what medicine is being given to them, and the results are fabulous. So
I wish I knew this last week.
So where's the placebo effect in this? So yes, there is faith. You have to have faith in your doctor. So you may sometimes even go to two doctors, but have more faith in one doctor and you'll say, oh wow, his medicine is amazing.
Yeah.
That's the faith angle. But that doesn't take away the fact that the medicine is doing its job. So it's not a placebo. That's myth number one.
Yeah.
Myth number two is the do's and don'ts. Oh, you can't have it with coffee, or you can't have garlic.
Right.
There are certain cases, certain specific remedies. It's not just an understanding for everybody. Some people say, oh, you can't have it because you have diabetes because it's got sugar. No, I dispense my homeopathy in liquid form for my diabetic patients.
Those
for the drops.
Right, drops.
Yeah, I can't give pills to a 3-month baby. This liquid medicine can be dissolved in the breast milk and given to the baby. So there are things like, it takes too long. Again, I disagree with that. If I have a long-standing illness like arthritis, I need to treat it regularly. I can give you some remedies for the immediate effect and some remedies on a constant basis to reduce the inflammation.
Right.
So yes, that treatment will be long-standing, but that is not because homeopathy takes long. You go to any system of medicine, they're going to treat you for that.
Passage of the disease or whatever it is. Yeah.
Yes.
What about from the preventative side? Do you do a preventive side rather? Do you do anything on that?
Yeah. So again, preventive comes 2 points. One is, oh, doctor, the season's not good, so I need some medicine because I don't want to get chikungunya.
Yeah.
No, it can't work like that. It's a viral. It's measles. It'll come. But yes, if I have a tendency of getting regular colds and cough, and if I take homeopathy for a good period of time and my immune system is much better, I probably won't get all the bugs that are going around.
Okay.
So preventive in that side, preventive for regular, like I said, bronchitis, asthma, so you won't get your episodes. Preventive for IBS, so that when you eat different foods or you travel outside, it takes care of that. So that angle, definitely preventive.
Okay. So then let me ask you a more specific question then. Say there's someone sitting in front of you who potentially has the risk of getting bald one day because his genes are so. If I had to ask you for any preventative help for that, do you have something for baldness?
Yes. So there is male pattern baldness, and the eventuality is that you would get bald at one point of time.
So you can help me, is the question I'm asking.
Yes, but I could delay it for you, definitely. I have good remedies for that, for taking care of your scalp, for delaying the process. And again, it'll be everything.
Right.
So with that will be the diet, with that will be the vitamins, with that will be the homeopathy.
Yeah.
So everything has to work in sync. It's not
It came back to your earlier point,
that.
mind, body,
Yeah.
everything. Yeah.
Yeah, it can't
in
be.
wellness.
So in wellness today, we talk about the importance of food, the importance of exercise. Mental health, everything has to come together, and homeopathy, being holistic, plays a fantastic role in this scene.
Okay, Doc, so one final question for you. A lot of people have this perception that homeopathy is filled with steroids and will affect the liver if you take it either once or many times or whatever it is. How do you address that kind of myth?
So absolutely not.
Right.
Homeopathy doesn't have steroids.
Okay.
I
What does
can't-
it have actually?
So the pills
Yeah.
are made of
Oh,
sugar.
generally.
Yeah,
Okay.
and the liquid medicine, what we call as dilutions,
Right.
are made from herbs, trees, plants,
Okay.
and that's what we add to the sugar, which acts as a carrier, or
Okay.
the liquid that acts as a carrier.
I see.
Homeopathy per se, no. Homeopathy has no steroids.
Right.
If a practitioner wishes in any field or in any line of business, if a goldsmith wants to mix something in your gold and sell it to you, you're not going to be wiser.
Yeah.
Right. So if somebody wants to mix steroids in a crushed form or in any form in homeopathy, he's basically cheating people. So that's not on homeopathy.
Okay.
That's not on a practitioner. So some of these myths, I would say some of these stories have come up with some
That applies
wrongdoings,
to
but that applies to any
everywhere.
field.
Absolutely.
Yeah, any field, right from any medicine to anything
Yeah.
sold, that applies everywhere.
Right, right. Well, it's quite clear that there's a lot of strength and power in homeopathy as there
I
is
do
in
believe
with,
so.
in anything. So it's
Yeah.
definitely something that we encourage here at the Wellness Center in terms of looking at all aspects of wellness. As you correctly pointed out, it can't just be one aspect that looks at wellness. So thank you so much for your insights, Doc, and thank you so much for being here.
Thank you, Kavas. Thank you so much.
So join us again for another episode of Wellness Date coming to you next week. Thank you.